Hi, I'm Harry. I'll be your occupational therapist today. Have you ever consulted an occupational therapist before? Okay. Would you like me to explain what we do? Okay. So you're here on the orthopaedic ward looking to get some elective orthopedic surgery, and it's basically my job to consolidate what the other health professionals have said, and I also need to see if it is indeed suitable for you to be getting it. And I'll also be preparing you for any details you might be interested in about the surgery and how you can go about and function after you have it. Yes. So, can I just have your name, please? Okay. Can I have your date of birth? Okay. Now, it is standard procedure on our orthopaedic ward for the last person who's going to check you off to go through the previous notes, because we start with the physical system, and then I shall be entering you into the system here, and I just need to look over the notes and make sure they're all correct. So I'll be asking you them again before we move on to the strictly occupational therapy type of interview. Okay. So you have seen the surgeon, and what is the name of the surgery that you are getting? Yes, it's laparoscopic. Yes. And do you understand what that entails? Okay, very good. Okay, and you have seen the physiotherapy, and you know that you will be attending physiotherapy twice a week for the next 3 weeks post-surgery. Okay. Okay, I know that people will have asked you these questions before, but it is my job. So, how would you rate the pain when using your affected limb? Okay, and are there any things that you don't think that you are able to do because of your injury, or the pain experienced because of your injury? And do you have any of those in your house? Okay, I might ask you more questions about that later on. Okay. Now, after we finish this consultation, you're going to need to move out and talk to the social worker, and then after you meet with the social worker, then you will schedule an appointment for whenever your elective orthopedic surgery is. Since you're in the public system, it may be some time, but from what you have told me, it does seem that you are able to continue living your life until that time. Okay. Now, on to the more occupational therapist range of questioning. I have a few questions that by procedure I need to ask you, even if they may not be specifically relevant to your injury, just because there are kind of very small chances where something can impact on something else and it doesn't intuitively seem like it does until you ask the patient. That's why. Yeah. Okay, so are you able to use the bathroom? Yes. Are you able to sit down onto the toilet? And do you have anything to hold nearby? Like, is there a bathtub or a cabinet or a handrail or anything? On one side there is. Is it able to support your body weight, or is it... Okay. Okay, that might be important post-surgery. Okay. Now, with the surgery, we encourage movement very early, and you will most likely be able to do most things. There are just a few specific movements that we discourage, as they may slightly damage or cause re-injury to the affected area. But besides that, walking, exercising and stuff like that is all encouraged. Sport and stuff like that, you'll be allowed to go back to around 7 to 8 weeks, depending on your consultations with the physiotherapist. And more intense things like wrestling or weightlifting, you would need to wait 12 weeks post-surgery. Of course, all of this is dependent upon your consultations with a physiotherapist and also your 10-week consultation with the surgeon. Now, you understand what surgery you are getting, and you understand how the surgery is happening. You will be discharged with about 2 weeks of pain medication. That's standard procedure for us. And then you will need to consult your GP, but I or someone else can write you a letter when you are discharged in the future for you to get more pain medication from your local general practitioner. You'll just need to get a further script off of them. Okay. Now, how many stories, how many levels is your actual house? And how many stairs? Okay. Where do you sleep? Which floor do you sleep on? Okay. And which floor do you spend most of your time on? Okay. You should technically be able to walk up or down the stairs as soon as you arrive home. But for some people, the pain is more severe. Some people it's less severe. Some people just tend to heal faster. So I would recommend you to go at your own pace, but if you have it within your ability, to push yourself a little bit within reasonable limits. If you forget any of the stuff that I'm telling you, we will be giving you a pamphlet with all the instructions and everything at the end, so you don't need to panic or anything like that. Okay, yeah. Okay. Now, you will most likely be able to do everything by yourself, except drive, because the affected limb will impact on your ability to drive. you will need to have an assessment, but likely you'll be able to resume driving within around 8 weeks. So, when you get home, do you know if there will be anyone living with you at the time? Able to prepare meals or help you in different circumstances? And how frequently will they be at home with you? Do they have to go out for work? Not at the current moment. Yeah, I understand. Okay. Now, in terms of washing, you likely won't be able to completely bend forward and wash all areas of your body at the moment. So, upon discharge, you'll be given an opportunity by either the physiotherapist or occupational therapist looking after you to either purchase some equipment, or they'll just explain to you what equipment you can use to wash yourself. We have the classic sponge on a stick, which is actually quite useful. I know it sounds a little bit strange, but it's very commonly used post-surgery. And do you have any questions about the experience post-surgery or anything involved in the post-surgery aspect? Yes. So with the scar healing is a quite complicated thing, but it really depends on a number of different variables, some of them slightly under your control and others not. So your genetics, of course, that's not under your control. That will determine how well and how quickly your scar heals, and also what type of scar healing you will get. Because this is a laparoscopic surgery, you won't get very large scars, most likely, unless you experience some more severe scarring. Okay, so and things that are under your control, which help with scar healing, is if you smoke, I would really stop smoking, but especially post-surgery, as many studies show that wounds heal much more slowly and less effectively for individuals who smoke. And, of course, your diet. And there are smaller things as well, like your stress levels and stuff like that, which may impact on the speed of the healing. But I think the most important things will be proper and adequate treatment, using an oil, maybe bio oil, a lot of my patients end up using to rub gently onto their scar tissue. Mobility, staying mobile and using the muscle, it will help tremendously in your rehabilitation. And of course, staying healthy and not smoking and stuff like that, and the outcome is most likely to be promising. This is a very well-refined process, and this elective orthopaedic surgery does tend to heal very quickly, and will help you get back to a normal rhythm in day-to-day life very soon. Okay, so when you enter or exit your house, are there any steps at all? Yes, okay. How many steps are there? Okay. Are there handrails on either of those sets of steps? Okay, and are there any differences in levels, any slopes, or any steps on the inside first floor of your house? Okay, that's good. Are there, can you imagine any, when you go into your kitchen, is there a slight little... Okay, very good. Now, something in your shower. Do you know how large the hob is? That's the little kind of step that you have that goes up into your shower, that stops water rushing out of the shower and going into the rest of the room, or do you have no hob at all? Okay, that's good. Okay, in your bathroom or your shower room, do you have any sort of non-slip mat that you're able to put down? Because you can either purchase one, you can rent one from the free loan pool of the hospital if we have any that have been returned. You can also rent one from a physio or occupational therapy store near you. Okay, I do think that would be a good idea. A lot of accidents tend to occur in the bathroom post-surgery, and it would be, of course, very annoying for you to have to get another surgery, or have to experience a longer waiting time before being able to do certain things like sport, or, it's good to be safe. That's basically my job. Okay, can I ask what it is that you do for work? Okay. Have you got leave because of the elective orthopaedic surgery? Okay. We may organise an occupational therapist or home team to come in and consult you about the work, given the physical nature of it. We may have to help make some adaptations for your work for the coming weeks, post that first 1 week of leave that you have. I don't specialise in that area of occupational therapy, but there are many return-to-work occupational therapists out there, and we have links to many that we can refer you to. Yep. Yes, yeah. Do you have any other questions? Yes, okay. Yeah, so in terms of bending movements or anything like that, you want to be very specific in terms of how you move and careful. So twisting in general is not advised for a long time, and bending mixed with twisting, especially forced bending with twisting or under any weight or load of pressure, is never advised from now on post-surgery. Weight bearing and bending and twisting for anyone, regardless of surgery, is quite dangerous for any limb or any joint, but especially anytime post orthopedic surgery, it is important to avoid bending mixed with twisting. Yeah. So bending on the ground, twisting over like that is a no-go from as soon as you get the surgery. You will still most likely be able to bend over and grab things and stuff like that, but some people, upon leaving hospital, can bend down and pick up things straight away. other people may need to use a long-handled reacher or get help from someone else, something like that. Okay, in terms of your travel between the hospital and getting home, how do you think you would do that post the surgery on the day? Okay, so you're getting driven, and they've taken leave off of work as well. Yes, okay. Okay, so in terms of getting into a car post-surgery with the impacted leg, you will be most likely taken through this with a physiotherapist in one of your in-stay hospital therapy sessions on this ward. You might see me assessing other people then as well, because this is the ward you'll be staying in. In terms of getting in and out of a car, a physio will take you through it, but I can just briefly explain the technique. So basically, if you imagine the door here, you open it and you sit back into the car. So imagine that I was here and I could open the door like that, and I was sitting in the seat facing you. If I wanted to get in, I would be facing this way, and I would sit back straight into the seat, and then I would lift one leg up, and then I would use my hand as assistance and lift up the impacted leg up over into the car. Then I would reach back, and then I would close the door. If that sounds too complicated or anything, don't worry, it's much easier than it sounds, and a physiotherapist, or possibly me or someone else, depending on who's staffing, will go through that technique with you post-surgery, and maybe we'll do it onto a box or something, just so you get practice before you get picked up. Okay, be staying. How long will you be staying? Okay, well, it really depends on a few things. Again, whoever is staffing, the occupational therapist or the physiotherapist, possibly the oedema management team will come in and do an assessment on the wounds. It all depends on a few different variables. Usually people get discharged within a few days, but it depends on their mobility. So I actually take people on the walk, so we'll be taking a walk together around the ward to see if you can walk far enough for me to be able to discharge you, because we want to know that you can actually make it out of the hospital into the car so that you can get home. Yes, so that is one of the variables. Another one will be just the mobility. So there'll be either a physio or an occupational therapist with a goniometer, a kind of protractor-like measurement tool, and we will be measuring the angles or degrees of movement that your limb has. Okay? And finally, what I was saying before about the oedema management team. We have an oedema ward below for people with chronic issues like lymphedema or anything like that. But post-surgery, sometimes there is some swelling, some kind of oedemic swelling around the injury. And either one of us on this floor, if we have the time, or one of their team will come up and use various different tools to measure the swelling around the injury. The surgeon, if they're on, may also come in and take a look at the wound itself, or most likely a wound care nurse will be looking at cleaning, preparing, and observing the kind of stage of healing that your wound is at. And it needs to reach a certain stage before we can discharge you. I know that This is a lot of information to take in, but it is my job to give you just a little bit of a brief understanding of what's going to happen with all of the different people, and then you won't need to be expected to remember everything because you'll be continually reminded. So we'll hammer it into your head that, no bending and twisting, how you can clean, everything like that. Yeah. So, your home does seem to be safe for you to go back post your surgery. You will have someone there who is able to look after you if you need it. Some people find that cooking and preparing meals can be difficult just because some people fatigue after a while of standing, and if you're standing cutting vegetables and stuff like that, you may need assistance from someone else. So of course you've got a variety of options. You can of course buy ready meals. You can have someone like a loved one or someone else prepare meals for you, or you can do things which are easy to cook. For a lot of my patients, I always recommend to buy things, just for now, that are pre-cut, like fruit and vegetables that are already pre-cut and frozen in plastic bags, just because you may not be able to stand for a long time and cut up a variety of different vegetables depending on what you're making. So just for the time being, I know that people don't like the use of plastic, especially where it might be avoidable, but in this instance this is an example of a situation where you should be using pre-cut fruit and vegetables. Do you have any pets? Anything that might do an unexpected kind of movement at you, like a young puppy who might jump up at you? Do you have are there any toddlers or young children that might, is there any chance that anything might kind of suddenly knock you or anything like that when you go home? Okay, that's good. So, okay, yeah. How long does the surgery take? That does depend on a few things, of course. It depends on the surgeon. It depends on how fast the surgeon works. It depends on the surgeon's preferred style. So, I don't know if you know this or not with your past experience with any surgeries, but there are standard ways to do a surgery, but a surgeon, of course, can choose their preferred method of doing various parts of the surgery, some of which take longer, some of which are shorter. But that's based on the current study that the surgeon has and their personal beliefs about, and their clinical expertise about what is the most effective, or their proven most effective techniques that they use, which I think is a good thing. It means that the surgeons can continue doing what they think they do best in light of their clinical expertise. So that's another variable which may increase or decrease the surgery time. It also depends on the, physiology, your anatomy, rather. It depends if when we have a look in, another variable, of course, is your own unique anatomy. So, because this is an arthroscopic surgery, they'll be having a look around in the given joint, and it depends if there's any scarring or anything, or any fat, or, there could be a variety of different things that they look at. And they may need to perform or do extra things like clean the site before they do any further operations, remove any excess scar tissue or anything like that. And so all of those types of things can prolong the surgery. And given also the time that you wake up is variable a lot. It also depends on how strongly you react to the general anesthesia. So you may take a little while to wake up. You may wake up fairly quickly. That, of course, is all up to your unique genetic makeup and your body's experience with anesthesia. So, for brief parts of it, they will be using an arthroscopic camera to be looking around the joint to see what could be causing the issues, and possibly, depending upon what they find, they may or may not go ahead with the procedure. Don't be nervous or anything about that. It's just that there always is a small percentage chance that the surgeon may see something and may want to talk to you about it or make a differing decision based on the anatomical findings. Based on all of the scans and everything that we've done so far, it does look most likely like just the general surgery will be needed, but it's my job to just warn you about things that are, in the small percentage of happening. In terms of risk level, this is a very low level risk surgery. There aren't many possible complications, though I will give you a pamphlet which includes a list of the possible complications and factors for you to look out for. So if you're noticing any of the factors on the sheet that I give you, you may want to consult a general health practitioner, or you may want to call in on our ward, and we could possibly find some time for you to meet up with the surgeon and consult him about the possible issues you've experienced. Okay. Okay. Let me just put my keyboard down for a second. Actually, sorry, I just have to write my name. And sign you off. This is kind of our digital version of doing a signature. Okay, let me just put my keyboard down. Okay, so talking to you, looking through your notes, and also in our collaborative team meetings that we have on the ward, it does look like you will very much benefit from this surgery. It should really increase the quality of your day-to-day life, allow you to be, more active, and decrease your experienced pain levels. So I very much wish you luck with everything, and I will be seeing you again. I'll be seeing you on, I think, probably the second or third day of your time in your stay post-surgery. Most surgery wait times, I think, for your type of, given it being elective surgery, I think are around 3 months. So maybe I'll see you around 3 months and 2 days. But yeah, most likely I'll see you and we'll go for a little walk and talk about how things have been. And I wish you all of the best. Now, you can find on the pamphlet my contact number, and that is my personal mobile phone number. And so if you have any questions, or if you feel like possibly you don't know if you could navigate a part of your house, if you need help returning to work, if you need a home care team to come in from the hospital, if you need any equipment like the sponge that I was talking about, or a non-slip mat, feel free to give me a call, a text, or send a message to my email, and I will get back to you as soon as I can and try and organise something for you. Okay? Thank you very much. Have a good day, and I hope the rest of the paperwork and everything goes well. And now it's time for you to go off and just go around the corner. You'll see the office directly around the first corner is the social worker, and you'll just need to meet with them very briefly, and they'll just go through your home living situation. It should be a bit briefer than this meeting, and then after that you'll go on to the waiting room, and then at reception they'll call out your name, and you can go through and organise when you are available and the hospital is available for the next elective arthroscopy. Okay. Thank you. Bye.